TAGRISSO osimertinib. Important safety information. TAGRISSO may cause serious side effects, including lung problems. TAGRISSO may cause severe lung problems that may lead to death. Symptoms may be similar to those symptoms from lung cancer. Tell your healthcare provider right away if you have any new or worsening lung symptoms, including trouble breathing, shortness of breath, cough, or fever. Heart problems, including heart failure. TAGRISSO may cause heart problems that may lead to death. Your healthcare provider should check your heart function before you start taking TAGRISSO and during treatment as needed. Tell your healthcare provider right away if you have any of the following signs and symptoms of a heart problem: feeling like your heart is pounding or racing, shortness of breath, swelling of your ankles and feet, dizziness, feeling lightheaded, or feeling faint. Eye problems. TAGRISSO may cause eye problems. Tell your healthcare provider right away if you have symptoms of eye problems, which may include watery eyes, sensitivity to light, eye pain, eye redness, or vision changes. Your healthcare provider may send you to see an eye specialist, ophthalmologist, if you get eye problems with TAGRISSO. Skin problems. TAGRISSO may cause skin problems. Tell your healthcare provider right away if you develop skin reactions that look like rings, target lesions, severe blistering, or peeling of the skin. Inflammation of the blood vessels in your skin. TAGRISSO may cause blood vessel problems in your skin. Tell your healthcare provider right away if you develop purple spots or redness of the skin that does not fade in color when pressed, non-blanching, on your lower arms, lower legs, or buttocks, or large hives on the main part of your body, trunk, that do not go away within 24 hours and look bruised. Blood and bone marrow problems. TAGRISSO may cause a condition where your bone marrow cannot make enough new blood cells, aplastic anemia, and which may lead to death. Your healthcare provider will monitor your blood cell counts before you start and during treatment with TAGRISSO. Tell your healthcare provider right away if you develop any signs and symptoms of blood and bone marrow problems, including a new fever or fever that does not go away, greater than or equal to 100.4 degrees Fahrenheit, easy bruising or bleeding that will not stop, unusually pale skin, infection, tiredness, or weakness. Before taking TAGRISSO, tell your healthcare provider about all of your medical conditions, including if you have lung or breathing problems other than your lung cancer, have heart problems, including a condition called long QTc syndrome, have problems with your electrolytes such as sodium, potassium, calcium, or magnesium, have a history of eye problems, are pregnant, or plan to become pregnant. TAGRISSO can harm your unborn baby. Tell your healthcare provider right away if you become pregnant during treatment with TAGRISSO or think you may be pregnant. Females who are able to become pregnant should have a pregnancy test before starting treatment with TAGRISSO. You should use effective birth control, contraception, during treatment with TAGRISSO and for 6 weeks after the last dose of TAGRISSO. Males who have female partners that are able to become pregnant should use effective birth control during treatment with TAGRISSO and for 4 months after the last dose of TAGRISSO. Females who are breastfeeding or plan to breastfeed. It is not known if TAGRISSO passes into your breast milk. Do not breastfeed during treatment with TAGRISSO and for 2 weeks after your last dose of TAGRISSO. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, or herbal supplements. Especially tell your healthcare provider if you take a heart or blood pressure medicine. The most common side effects of TAGRISSO when given alone include low white blood cell counts, low platelet counts, low red blood cell counts, anemia, diarrhea, rash, muscle, bone, or joint pain, changes in your nails, including redness, tenderness, pain, inflammation, brittleness, separation from the nail bed, and shedding of nail, dry skin, mouth sores, tiredness. The most common side effects of TAGRISSO when given alone after treatment with platinum-based chemotherapy and radiation treatment include low white blood cell counts, lung problems, low platelet counts, rash, diarrhea, changes in your nails, including redness, tenderness, pain, inflammation, brittleness, separation from the nail bed, and shedding of nail, cough, COVID-19. The most common side effects of TAGRISSO in combination with pemetrexed and platinum-based chemotherapy include low white blood cell counts, low platelet counts, rash, diarrhea, mouth sores, changes in your nails, including redness, tenderness, pain, inflammation, brittleness, separation from the nail bed, and shedding of nail, dry skin, increase of a substance in the blood called creatinine. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of TAGRISSO. For more information, ask your healthcare provider or pharmacist. What is TAGRISSO? TAGRISSO is a prescription medicine used to treat adults with non-small cell lung cancer, NSCLC, that has certain abnormal epidermal growth factor receptor EGFR genes to help prevent your lung cancer from coming back after your tumor has been removed by surgery, or when your lung cancer has spread to nearby tissues, locally advanced, that is unable to be removed, unresectable, by surgery, and has responded or stabilized following chemotherapy and radiation treatment, or as your first treatment when your lung cancer has spread to other parts of the body, metastatic, or in combination with pemetrexed and platinum-based chemotherapy, as your first treatment when your lung cancer has spread to nearby tissues, locally advanced, or to other parts of the body, metastatic, or when your lung cancer has spread to other parts of the body, metastatic, and you have had previous treatment with an EGFR tyrosine kinase inhibitor, TKI, medicine that did not work or is no longer working. Your healthcare provider will perform a test to make sure that TAGRISSO is right for you. It is not known if TAGRISSO is safe and effective in children. For additional information, please see complete prescribing information, including patient information, at TAGRISSO.com. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.